basically, this is the story behind chronic pain. So I just wanted to tell this story, how pain is like, what suffering is like, and what you feel it like when you are ill. So in this lecture, I'm basically trying to concentrate more on chronic pain scenarios. I'm not going to talk about acute pain scenarios, which I think is more or less a job of a attending clinician, be it a surgeon, physician, cardiologist, pediatrician, whoever, or an anesthesiologist. I'm going to focus this lecture on chronic pain, and in front of that also, I'm not going to talk about chronic cancer pain management, but I'm going to talk more about chronic non-cancer pain syndromes. Disclosures-wise, I don't have any financial commitments to any particular organization or pharmaceutical company or any research work because of financial benefits, but I have some non-financial commitments. So I'm a member of World Institute of Pain as well as ISP, International Association for Study of Pain. So about a year and a half ago, basically, I thought I should do some examinations as well. So I qualified in fellowship examination in Interventional Pain Management by World Institute of Pain. If you go to the website, you can get more details about it. If you are interested in doing pain practice or whatever management, this is the website to go to. So past 10 years of FIPP examination, we have about 738 FIPP qualified physicians basically in the world since its inception in 2001. So we have our local chapter actually. India, Pakistan and Sri Lanka basically. We have about 34 FIPP qualified physicians in our subcontinent, basically this region, India, Pakistan and Sri Lanka. So you have to see the whole name list. Probably at the minute I think I'm going to be the only one here practicing this sort of a story. But anyway, you can go to the website and see more details. If you are interested, you can do the examination or you can even learn more from them. So I have certain commitments towards these organizations in preventing pain as well as suffering, and therefore I have some binding responsibility to the society or the communities, both medical and non-medical, in informing them what's happening with chronic pains. So in this lecture basically I'm trying to go through 3 different topics, headings actually. These headings actually, individual headings will be different lectures by themselves. Anyway, to give you a bit of a big picture, I'm going to talk about all these things, but I'm rushing through these topics because of time constraints. So identifying the big picture. Now chronic pain is the most prevalent non-communicable disease around the world. Now we don't have our figures, but these are US figures. It says millions of people do suffer from chronic pain, which is defined as pain lasting more than 3 months. And 22% of all primary care patients will have chronic pains. About 80% of Americans do believe pain is just a part of getting older, and 28% believe there is no solution for their pain. And about 42% of people believe their doctors will completely understand basically how their pain makes them feel. And if you take the prevalences of non-communicable diseases, like diabetes, coronary heart disease and stroke, this US data again, their prevalence is like 6 to 7%, whereas chronic pain is about 26, about 4 times higher than that. Whereas cancer pain is very much less, that is because their mortality is high, numbers are not accumulating. Whereas chronic pain patients, numbers do accumulate. So there's a staggering number of patients do suffer from chronic pain every day. So it's going to be a huge medical problem. It's a huge problem to the community as well as to the health budget. So what are the chronic pain syndromes we come across commonly? So these are the chronic pain syndromes: low back pain, headaches and neck pain. So putting these 2 things together, spinal pains would be the most common of the chronic non-cancer or non-malignant pain scenario we see in our practices. So, what are the consequences of mismanagement or undermanagement of pain? And the extensive, costly, unhelpful workups and treatments done on these patients, dysfunction in families, jobs, and the social life, mental physical suffering, increased disability costs, increased daily expenditure, and increased suicidal rates. It's about 20 times higher on chronic pain sufferers. So, EU Parliament actually has understood this, and they have passed a white paper in last September saying chronic pain as a common symptom to all NCDs. They are going to look into this problem differently and consider chronic pain as a non-communicable disease. I will go through the associations of chronic pain.